Thank you so much, everyone, for joining us today for our July All Hands on Deck call. We're glad to have you all with us, and we are super glad to have both Monica Davis and Senator Knopp with us, and we're excited for them to share all that they've been doing around drug-endangered children efforts and legislation happening in their state of Oregon. They will be able to take some questions towards the end, so if you just want to put those in the chat or hang on to your questions until the end, then we can discuss some of those at the end of the training. But Monica and Senator Knopp, I'm going to turn it over to you.
Well, thank you, Carrie. I really appreciate the opportunity to be with all of you, and thank you for all the work that you do. I want to thank National DEC, Eric Nation, and Carrie Jensen for making this possible. And of course, want to thank all of you for the work that you do day in and day out to help our kids. It's really important. So we wanted to speak with you today and give this presentation about how to change, how to create change through reforming legislation. And it's really important for us because Oregon has been sort of ground zero for the decriminalization of drugs. And we wanted to do something pretty special for kids. And so that's the presentation today. We're going to have some content that we're going to have that we'll go through, and the content is essentially our background, and then our solution, our situation, our timeline that we went through, the analysis and research of the project, the recommendations that we came up with, and then of course the solutions. So I am Senator Tim Knopp. I'm an 18-year legislator in the state of Oregon. I have worked most of my career to try to make sure that we are passing the best policy possible in a bipartisan way. And I've been very successful in being able to do that. But really, what's made me successful is the team that I have surrounded myself with. And so Monica Davis is one of those people. She's a senior advisor and policy analyst. And I also have hired my son a couple of different times. He left me, then he came back. But my son, Reagan, has worked in my office as well. And we've had just a great group of people that we've been able to interface with. And so I'm going to turn this over to Monica Davis, who is a great partner and advocate and has done a great job in making sure that we pass the legislation that was kind of foreseen of what we wanted to do this past session. So Monica, why don't you take it away?
Sounds great. Thank you so much, Senator Knopp and Carrie. National DEC, we're really honored and humbled to be able to have this opportunity to share our experience with how we were able to create some cultural change in the state of Oregon. A little bit about me. I have my bachelor's degree in psychology as well as early childhood with a double emphasis in crisis intervention and addictions. And I just completed my MBA, Master's of Business Administration from Willamette University. I went back to school as a returning adult student, independent parent. I, through that process, was asked to join Senator Knopp's team as his senior advisor and policy analyst for the state of Oregon. And during the short session, to oversee the Human Services Committee, as well as secondary for addictions and the Addictions Committee, and then the Public Safety Committee. So a little bit about my background. Gosh, as I mentioned, I started with this whole process as a returning adult student, and I started as AmeriCorps, to be honest, working with the homeless and runaway youth, and then was asked to run our sexual assault center as well as our alcohol and drug coalition. And it was during that time, over a decade ago, that I had the unique opportunity of meeting Cindy Giese from Wisconsin DOJ and Eric Nation as he was coming on board. Through that process, I wrapped up my professional career in Wisconsin as the executive director of NAMI Brown County before I went out to Oregon. So that was back in 2019, and here we are, 2024, and I think the rest of our slides will kind of fill in the gaps on that. So sharing with you a little bit about Oregon, I think it's important to just kind of know the landscape of where we're coming from. You know, the trainers and professionals from National DEC, they're all over, right? And when you walk into a community, when you walk into a state, every state's different. And so sharing with you a little bit, Oregon's population, you know, they have over 4,223,973,000 individuals within their state. 750,000 are children, which is 19.5% of their population. And these statistics are based off of the 2023 census. I think it's important to also understand the culture. Having pretty much been raised in Wisconsin, I've always dubbed Wisconsin as Little House on the Prairie. Any of you who've been out in the Midwest, it's like, you know, if you need a cup of sugar, you go to your neighbor and you get a cup of sugar. And I was, you know, raised in the rural communities. And so if I needed some eggs for my mom, you know, we'd walk next door to the neighbor or whatever. And then also having lived in Arizona and Maine, and, you know, Oregon's culture is different on the West Coast. So sharing a little bit about what that looks like. We're a sanctuary state, meaning that undocumented refugee population individuals, they can come there and feel safe and not have the fear of being identified or deported. We had certain legislation passed years ago in regards to what's called the Justice Reinvestment Act. It's taking those crime fines and reinvesting them into victim of crime organizations, which also created then what was called the CAMI funds. When I moved to Oregon, there were so many conversations and people kept referencing these CAMI funds. I'm like, what are CAMI funds? So it's very unique to Oregon to have what's called CAMI funds, which are child abuse multidisciplinary intervention funds, which are specific for child advocacy centers and the multidisciplinary teams. ODHS, Oregon Department of Human Services, has also, we're a pilot state out here. So they are piloting a different child welfare, what they're calling prevention model. And so that has definitely affected the interaction and working with the children that have experienced abuse or neglect and witness of a crime. We also have something called Carly's Law out here. Some other states do have Carly's Law as well. I want to say Texas has Carly's Law, wherein we'll talk about Carly's Law here in a little bit, but this has definitely been instrumental in some of the interactions with all the different collaborative partners. And we're on the I-5 corridor, which especially within law enforcement, I think that they'll recognize that when you're on a highway that connects you from coast to coast, from country to country, from Canada to Mexico and going through California and Washington, where you know, it's a dangerous corridor to be on, especially for children. In addition, we're a hub for the unsheltered. Within the state, we have a very high level of what we call unsheltered individuals. Some people might relate to them as houseless individuals. We also legalized all illicit drugs back in 2021. And that looks like, you know, heroin, methamphetamines, cocaine, fentanyl, all of that was considered legal inside your home and to utilize in public. At the time when we were going through doing our research, there was 24 CACs in 36 counties. So not quite a child advocacy center for every county. In addition to that, we're a social experiment state. You'll hear that term to reference. The senator was on Dr. Phil, and it came up there too. Our state has been a hub for trying different social experiments when it comes to various different topics. So during this time, really covering the time frame between 2019 and 2024, some of the things that were going on behind the scenes, they were going on nationwide as well, but it's important to bring them up as well because it affects how the children were affected and how the landscape looks now. So of course we had COVID, the pandemic that launched in 2020, all of Oregon shut down during that time. In May of 2020, sadly we had the riots, and I think the riots were probably all over the country. In Oregon, sadly, though, we had riots every single night for months at a time. Wherein not only in Portland, which is Multnomah County, one of the largest counties in Oregon, but also in Salem, and Salem's where the capital is. And we were instructed not to go outside because of the amount of controversy that was going on. The National Guard had to come out to protect communities and keep us safe. In addition to that, it was a crazy year. We had forest fires that took over the entire state. It was unprecedented, the forest fires. Thousands of people lost their homes, businesses. We are very, the timber industry is very intricated into the economy here. So just forest fires throughout the entire state, which was just never heard of. And coming within, they often would say that the fires would stay in the valleys. Well, they came into the city as well. So evacuations had to happen. And then lastly, we had an ice storm in January of 2001, where in the state of Oregon, in Wisconsin last winter, I was out there, I was snowed in for, gosh, I think 3 times for days at a time, which you kind of expect in Wisconsin, you kind of plan on that. But in the state of Oregon, the geography out here, they don't expect to have that kind of cold. So the trees were filled with condensation, and the trees then would split and fall on the houses and on the power lines and all that. So it created a national a state of emergency, wherein there were a lot of people that didn't have power for weeks on end. All of which, just to share with you a little bit about what Oregon was facing during this timeline, because I think it definitely speaks to the need for improving the prevention and the efforts and the support and resources, especially for the children. So taking you into the beginning of the timeline a little bit, during this time as well, back in 2019, a community needs assessment was brought to my attention. And it showed gaps, especially not only with children who've experienced abuse and neglect. This was a specific community needs assessment for a rural community in Oregon. And it just kind of opened up the door a little bit, that awareness, like, wow, if only so-and-so, this a small number of children are being serviced or helped, what's going on with the rest of the children? And my background, specifically more so with with sexual assault, I'm like, gosh, I know the numbers. It's like 1 out of 4 girls and 1 out of 6 boys. So if it's 2 out of 10 kids and only the small number of children receive services, there's got to be, why, what's going on here? So 2020, again, we had COVID, riots and forest fires. And at the beginning of 21, we had the ice storms. But in 21, we also decriminalized all illicit drugs in the state of Oregon through what was called ballot measure 110. And I'll let the senator share more about that, because he was aware of and working in that whole area too. So we'll talk more about that, but just to kind of show you on a timeline when that happened and how that looked. And then in 2022, the ODHS, Oregon Department of Human Services, Children and Families report came out, which showed, and I'll talk to you a little bit about it here in a few minutes, showed in the research the thousands of children that were being reported for suspected abuse and or neglect. So this next slide is a short video that was shared with us of just what Salem, which is where the capital is, what it looked like during this time. And gosh, up until, well, it still looks pretty rough, to be honest. So I'll let you watch this video and I'll come back in a minute. every time I watch that video, it just gives me chills, and it's so sobering because sadly it's not safe to walk on the streets in Salem, and that's what we were experiencing. So in 2023, we started to review the numbers, and we'll get into that a little bit more. Continuing the timeline, in 2024, the first quarter, we recriminalized all illicit drugs, meaning the legislature did, and it was quite the conversation because they did not want to infringe on anybody's civil rights. But being a passionate advocate, especially for the children, like who's standing in the gap for the children, who's taking care of them. And in 2024, one of the pieces that we'll share with you today is just relaunching of National DEC, Drug Endangered Children in the state of Oregon. So how did we create change through reforming legislation? I know that's why everybody's here today, and we'll share with you our step-to-step process, a little bit about what we went through, and it might look a little different depending on the state that you live in, but I think it's pretty solid. But these are the steps that we took in order to reform legislation, and all the stars aligned, and it worked. First step was identifying the problem. Clearly, there was a problem, and we needed to figure it out a little bit deeper and really get down to the root of it. It wasn't just like there was a sliver, like how did this happen, and unpacking all that, which was happening through the research. Did literally years of research, but in 2023, really all the research decided to come together. Found a legislative champion, Senator Knopp. He's my champion when it comes to reforming this policy and legislation, and talk more about that. And developing a legislative concept. What did that look like? Telling the story, and then eventually passing the bill, which we were successful with. So identifying the problem, going back to that needs assessment, that was the first time, I think the beginning of it all, at least for me, it was like there was this needs assessment that came to my attention, and through that, there was clearly a gap, and it just started opening up that conversation of like, where is the gap happening? How is it happening? All of that. And that's step two, that research. What does the data say, right? It's all in the numbers. I would have never said 10 years ago, I was a data geek, but oh my gosh, the numbers, definitely they can be skewed, but if you know how to unpack them, wow, they can really speak volumes. So showing you a little bit about what that looks like, some of the research that we referenced was the Doris Duke Foundation. That's what Oregon is part of this pilot program for the reforming the child welfare system. What does this really look like? And having not only been a foster mom in Oregon and a mom, and then having just understanding of working in silos and collaboration and all of that, I'm like, how is this actually working? And so pulling these reports, national standards of accreditation with child advocacy centers, being passionate about best practices in trauma-informed care. The National Children's Alliance also publishes numbers year after year after year about how many children are being served through the child advocacy centers. And so pulling those numbers. And, the annual report, the 2023 HIDA, High Intensity Drug Trafficking Awareness Report, that was out as well, and starting to look at those numbers. As an example, I had mentioned the Oregon Department of Children and Families 22 report was reflective of the 2020 numbers. And we're not here to discuss necessarily the numbers we found, but just the resources we utilized on our journey. And it was showing us that there were 35,461 screened in referrals for investigation. That didn't count just the phone calls of the referrals. And moving forward, then looking at the National Children's Alliance 2020 numbers, 6,221 children actually received services from CACs, which was just, that alone was just mind-blowing to me. I'm like, gosh, the discrepancy on that. So started to compare the data, right? Like, gosh, we have all these calls for child abuse and neglect. And I want to take you back again, like what's going on in the landscape. We've legalized drugs. We've had massive trauma. We've had the riots and the ice storms and COVID and all of these things. And this is how it was affecting the children. Interestingly enough, though, in Oregon, like I think Texas is another state that also has this law. Maybe some of your other states has Carly's Law as well. Oregon had Carly's Law, which states that all children who have been suspected to experience abuse or neglect are to receive services within or treatment within 48 hours. Well, when you have such a gap of number of children receiving services and the number of reports, screened in reports, what's going on then with the other children that are not getting services, which created a huge question. So that brings us to this transition of, yeah, you know, Zig Ziglar, I've always viewed him as a motivational speaker, but he actually has this quote saying, you know, our children are the only hope for the future. But if we're the only hope for their present and their future, somebody's got to stand in the gap. And what do we do with these numbers to create cultural change? But more importantly, how do we protect the children? And so with that, I'm going to turn this over to step 3, which was finding a legislative champion and introducing Senior Senator Tim Knopp. It's truly my privilege and humble honor to be able to introduce him. As he has mentioned, he has served in the legislature for 18 years, not only as the former minority leader during the 2023 session, leading the walkout in the 2022 session. Is that correct, Senator? You'll correct me if I'm wrong on that, but also the majority leader as well in the House, which apparently it's very rare to be the leader in both the Senate and the House. He's a seasoned legislator, so he knows how to navigate truly the politics in his sleep. I've just never, wow, it's been mind-blowing to watch. But he's also like-minded on causes. So with finding that champion, he was like-minded. He's been an advocate for the underserved, for the marginalized. He's been an advocate for the children, for survivors of sexual assault. So he's like-minded in these causes. And I needed someone who was going to be, this was their passion as well. And he believes in collaboration. And you'll see this while he shares this part of the story of how we were able to create change. He believes in collaboration, and he has those relationships with, you know, in our state, it's very divisive. There's red and blue and there's purple. He believes in the purple, you know, let's collaborate. Let's make our state a better place for all people. And he has a successful track record. I don't remember or know off the top of my head how many bills he has passed, but he has a binder of them. So he knows how to do this. And this, he is 100% responsible for being able to make this whole process successful. And so with that, Senator Knopp, I'm turning over the presentation to you.
Great. Thank you, Monica. Really appreciate it. So if we advance to the next slide here, the short session in 2024. So this was going to be my last short session. The Oregon Supreme Court said I could not run again. Long story, won't share that with you today. And I think Monica wanted me to brag. There are 400 pieces of legislation, bills, that I've either chief sponsored or co-sponsored over the years that have passed. And a lot of those have to do with protecting children, anti-human trafficking, sex trafficking, labor trafficking, anti-harassment, and basically just making things better for people, which I believe is what we need to do. So coming into the short session was really important for me to want to be able to make it count. And Monica Davis had brought to me really just this issue of what do we do for the kids, and can we do a bill that will improve child advocacy center funding and treatment and options for kids? And I said, absolutely, but I'm going to need you to be on the team in order to pass this bill. So Monica did join my team in December of 2023, and the short session is only 35 days. And, you know, so you can imagine how difficult it would be to get anything done in a government process in 35 days. Usually you're waiting for a return mail on a government program for 35 days. So you all probably know how that works. So we came up with the legislative concept, which was step 4. And Monica brought this legislative concept And one of the goals was to increase funding for child advocacy centers. And we wanted to, we wanted to do it a lot. We wanted to have a big impact. And we also wanted to make it permanent, because what was happening is that all this was temporary funding. They had to fight for it every year. And I don't believe that it should be the policy of any state that as long as your dinner and auction fundraiser goes well, children will receive services. I don't think that's the right policy for the state of Oregon or any other state. And so we wanted to increase funding, make it permanent. We wanted to bridge the gap and create more CAC either services or opportunities for people to get there. A lot of times people who are not being able to be served are because they're afraid, because they don't trust law enforcement, because they can't get a ride to the local child advocacy center. So we wanted to spread those services to historically underserved areas and constituencies. And then the third thing is we wanted accountability for funding, and we wanted all child advocacy centers to adhere to national best practices. And we were able to accomplish many of those things in the bill that we brought forward. And the great part about this bill was that's when I met National Alliance for Drug Endangered Children and Eric Nation. So this is Mock and I testifying before the committee that it went through, that the bill went through, and we are telling the story. And Eric Nation provided testimony, both oral and written testimony, that was key to being able to pass our bill and to show support. And it was, it was a historically disadvantaged, disenfranchised girl that came to Monica and told her story of abuse and neglect and what happened. And she didn't get services, and we need to make sure that every child gets the maximum amount of services that they can get, whether they're neglected, whether they're abused, or whether they're drug endangered. And so that was our goal through working this bill. It's Senate Bill 1579 is the bill number, and we called it the Child Health, Safety, and Equity Act. And it was, it was really a work of passion for us, because we wanted to make sure that the impact that we were going to have would spread throughout the state, so that there would be equity across the state, that it would make kids safer, fewer drug endangered children, fewer abused and neglected children. And we had to make sure that the funding was there to be able to provide those services to make that happen. And so we did. And if you go to the next slide, we will show you that the bill was about trying to get people interested and involved. And one of the people that signed up right away in a bipartisan coalition was Senator James Manning. And so Senator Manning's a great guy. He's from Eugene, Oregon, and he and Monica and myself were the three key people that worked on this bill. And without that bipartisan support, you're not going to get something done in a legislative process. And sometimes it takes multiple sessions to get it done. And I was able to get some funding in a previous session for child advocacy centers and for kids, but it was only temporary. And so the great news is through the bipartisan efforts that were made and through Monica's help pushing this through, we were able to get some permanent funding, a higher level. And when we passed this bill, this is a copy of the final bill. It's more pages than this, but we gave you the first page and the last page. And you can see that at the top, there's a lot of names there. And those are bipartisan legislators who signed on to this bill, 40 plus legislators. There's 90 legislators in the state of Oregon. So we had almost half of the legislature signed on to this, and a good portion of the Senate. And that was thanks to the efforts of many people who worked very hard to help kids. And we're very proud of this effort. So here's the governor signing the bill. That's Governor Tina Kotek, who's sitting down holding the bill. And right behind her is Justin Brecht, who was part of my Senate Minority Office, as well as Monica there. And they were the two staff people that put in so much time and effort. And without either one of them, it wouldn't have been possible. And Reagan's on my other shoulder, my oldest son. And then there's a couple legislators on the far right in that photo. And Senator Manning's staff person is on the far left there. But this is the group that ultimately was helpful and accountable to get that bill passed. And we knew that more needed to be done in this session. And so while we were working on this bill, we were working on two other bills. So I was on a committee that was reforming Measure 110. It was clear that Measure 110 was not working. It was clear that we needed to go a different direction policy-wise. You saw in the video just what it's been referred to as a dumpster fire that Portland and Salem was and is. And literally the cities were ruined, and that was policy driven, really. The legalization, decriminalization is really what it was, but turned into a very much of a open air drug market as well as open drug use. Neither one of those were supposed to happen, but they did. And one of the troubling aspects of this for me was just that the message was given to kids that, hey, you know, if it's not a criminal offense, why not? Maybe we should try it. And with the advent of fentanyl, trying a drug now has a very deadly consequence, and one dose can kill you. And it has. And there's been all kinds of tragedy surrounding that. But this is where National DEC really jumped in, and Eric Nation came in and gave us a lot of support and advice on what to get in these bills. And so one of the things that Monica wanted to do is, as these bills were working their way through, there's a policy bill and then there's the financial bill that backs up the policy. And there was going to be $250 million spent in House Bill 5204. So we focused some efforts to try to get National DEC reconnected to Oregon. And so if you go to the next slide, Monica, we use the 2023 HIDTA, High Intensity Drug Task Force annual report, which is fairly long, but had a ton of great information. And this particular report was for Oregon and Idaho. And it basically showed that drug use was increasing and drug arrests had decreased because there was no longer a need to arrest people. Law enforcement didn't want to arrest people for doing drugs or having drugs on them because they were hard cases to make, and there were quite a few DAs that wouldn't even prosecute anyway. And so you put yourself in a dangerous situation whenever you're going to take drugs off of someone, especially someone that is likely high. So right after session, we were invited to go on the Dr. Phil show. You can see Dr. Phil there. And one of the slides that they had was Oregon drug decriminalization has failed. And boy, it really had. And Dr. Phil wanted to know why and who thought this was a good idea. And so we got to share with a national audience about what that looked like. And so one of the slides that they had was the overdose deaths in Oregon. And so pre-decriminalization would be before 2021. And then you can see that the deaths were increasing, but what they did is it just exponentially exploded after 2021 when ballot measure 110 was instituted, which was the decriminalization of drugs in Oregon. And it was just a massive spike, and kids were dying basically 3 people a day were dying in Oregon of drug overdose, most, not 100%, but pretty exclusively fentanyl. And lots of children were lost. And, everybody knew somebody who had either their family was impacted by this. And so if we go to the next slide, we have National DEC coming in, and you may have seen this video, but we'll play this video for you because I think it's just so important what the National Alliance does.
The National Alliance for Drug Endangered Children is working to help people across America make a difference in the lives of children who are affected by substance misuse.
We provide training, technical assistance, and resources to local alliances, community organizations, and individuals, helping everyone concerned provide the best possible options for the children who need us.
1 in 8 children in the United States live in a household with a parent who has a substance use disorder.
Over 9 million kids are affected by household substance misuse.
Children living in homes with alcohol and drug use experience adverse prenatal and postnatal effects.
These kids have adverse childhood experiences with related physical and emotional health challenges.
In some of the worst cases, innocent children are exposed to human trafficking,
abuse,
persistent violence, and chronic neglect.
Without proper intervention, these children run the risk of substance misuse themselves, perpetuating the cycle for the next generation.
The goal of National DEC is 100% healthy and safe children with strong families and communities, free from the negative impacts of drug activity and substance misuse.
We help develop and equip state, tribal, and local alliances and support individuals and professionals.
We provide training on how to identify children as early as possible, work collaboratively to intervene, and connect those in need with comprehensive follow-up services.
And National DEC recently launched a nationwide mobile app called Check DEC
to connect victims, survivors, community members, and professionals to resources and services within their own communities.
The National Alliance for Drug Endangered Children is challenging all of us to recognize kids at risk and work together,
leveraging our collective resources to protect our children from abuse and neglect.
Learn more about National DEC in our state, tribal, and local alliances
at nationaldec.org.
So just so helpful from the National Alliance perspective. And what happened was through those efforts and through figuring out how much we wanted to do, we were able to get in Section 13 of this bill. And I know it's a little small, you can't really read it, but we got $750,000 in training funds and funds for drug endangered children. And when Monica mentioned earlier that we're kind of an experimental state, our child welfare department basically was experimenting, and the goal was to keep families united. But in doing so, what they were doing was they're leaving kids in drug endangered situations. And so we had just time after time, we were seeing kids that were in basically in a drug house with a parent or two doing drugs. There were even kids that were found after their parents had become deceased from drug use, and the trauma that is involved with kids there. And so really what we wanted to do is make sure that our state was connecting with the National Alliance for Drug Endangered Children and doing what we could to educate all of those partners that need to be educated. And, we need to go back to the days of when we were all united and fighting, the meth house scourge. I think you probably all remember those days. If you're old enough, you do. And we were able to mostly wipe that out, but it took everybody working together to make that happen. And so we were able to pass this bill and get that money. And so contracts have been signed, and National DEC is going to be doing some trainings all across Oregon and providing the equity and training that we need across the state to basically help kids be in a safer environment and lock up the bad guys. And so that's the goal. So I believe our next slide is just to provide you with our contact information and let you know that we're happy to answer any questions. I think we still have some time here today that we can answer some questions. So Carrie, I don't know if you want to lead that. Maybe there are some questions in the chat. I haven't really been watching that for sure, but people have questions. We'd be happy to answer them now, or you can certainly email or phone us.
Thank you so much, Senator and Monica. We really appreciate all that you're sharing and the ideas that helps plant for other people to figure out if legislation is the way to go in their state and to help support their drug endangered children efforts. I have not seen any questions come in through the chat yet, so people might be processing here still. So if you have a question, you're welcome to pop that in the chat, or we're even at the point now that you could unmute yourself and ask your question if you have that. As you guys, Tabitha, did you have one?
I don't have a question, Carrie. I just want to congratulate them on all their efforts there in the state of Oregon, and continue to do the great work. Thank you for sharing today.
Thank you. We appreciate that. And you guys have done an awesome job at the national level. And there are states who are doing a great job as well. And, we want Oregon to aspire to be one of those states. And so you really, basically, as Monica said, you have to have somebody that's willing to stand in the gap to do the work and, to get it done. And that's what we did. And we were very successful. And, we're honored to be able to share that success with you guys today.
So one question is, people are still thinking that I'd asked you to before. You had a very large fiscal note attached to this legislation, the $750,000. Would it have still been a success in your mind had that money not been connected to it?
There would have been successes, but not to the degree that we wanted to have, because we had an Oregon DEC organization years ago, as I mentioned, and it was kind of during the meth era, and kind of shut those meth houses down, and kind of went away. And people, I don't think, really knew how critical the continuing education piece of this was, and staying connected. Because, guess what? When there's money involved, drug dealers do not just give up and go, oh, never mind. You redirected us from meth. They came up with new and even more powerful, more deadly drugs. And here's the unfortunate part: cheaper drugs. And that's what makes this so much different than a lot of other, drug eras, is that you can literally go out and get a hit of fentanyl, which they take about 10 to 20 times a day. And they're basically $1 or less, and very cheap. So, we have redemption of bottles and cans in Oregon, and literally, 10 cans equals one hit of fentanyl. And that's what you see as these drug addicts. They'll either commit crimes, or they'll collect cans and bottles and go to the redemption centers and go get their next hit. And, we need to do what we can to stand in the gap and stop it.
Senator, if I may as well, one of the other pieces is, yes, we were able to get the $750,000 for National DEC, and I am just so grateful that we were able to do that. But we were also able to get $7 million for the CACs in our state, because, though you don't need money in order to necessarily equate a success, we need more support, because many of those CACs were at max capacity and their resources were limited. And but additionally, it was also important to at least advocate for best practices. I think all of the people on the call today would agree that you can have practices, and they might not, and if they're not at that highest level of standard, then that doesn't necessarily mean that you're maximizing on being able to help and serve the marginalized and underserved populations, but specifically the children. So yes and no. I think that the finances, though, the fiscal piece of it has and will continue to help the CACs, the children across the state. But it's twofold. I think having those best practices is also important too.
Totally agree with that. We did get a question in the chat asking if you could share the link to that first video, the Salem video. Is that something that you can share, Monica, or would you like me to do that?
Let's follow up with that afterwards, and we'll see if we can go ahead and do that.
Okay, yeah. So if you can shoot us an email, either to Monica, whose email is up on the screen, or if you also email info@nationaldec.org, we'll make sure we can follow up with you on that too.
Very good.
Any other questions? And knowing if you think of these questions later, that we are able to connect you with both the Senator and Monica as you start moving down that path and considering what legislation might be a right fit for your states and for where you're working. We're happy to continue to connect you. Brooke, did you have a question?
Yeah, I just have a couple. One, after seeing that first video where you all showed this is Salem, what is the pulse like of your law enforcement there? It seems like they'd be so overwhelmed, and just, are they super supportive of these efforts, realizing like we need to do something different, or are they just exhausted and tired and thinking this isn't going to change because they're such a critical partner in DEC efforts?
Yeah, that's a great question. And what we saw, and maybe what was happening in some national, efforts, was this defund the police stuff. And sort of the police became the enemy somehow. And so we were supportive of law enforcement, and they were very supportive of the recriminalization effort because they realized that they were losing control of the streets through these policy efforts that had been pushed by the Drug Policy Alliance. It's a George Soros funded group. And there's dozens of these groups that have all kinds of fancy names that make it sound like they're doing good work. But in reality, what they want is they want drug legalization across the United States and worldwide. And no penalties, just drugs are a choice, and they're a choice that people make. And it's okay because it's their choice. And it's not okay because it damages them, it damages families, it kills people, unsuspecting kids that think they're taking some sort of a ecstasy pill and they end up with fentanyl. And it's a lot of it's fentanyl laced drugs. And so law enforcement was very supportive. So what happened was we banded together on House Bill 4002 because there was an element within the Democratic Party that just wants to legalize drugs and doesn't want any change. And they couldn't get the votes to basically keep the status quo. And so it became a bipartisan effort because of law enforcement taking a stand with us and holding firm that this had to happen and we had to make a change. And so that's where the recriminalization came from. And so I think they're starting to gain some ground. There's also other things in this bill that helped because of some very poor court decisions that had been made that didn't really allow law enforcement to take drugs off of people when they had them illegally. And it had to do with the way they had to search and what they had to have in order to do a search and things like that. And so that was clarified in this legislation. It was super helpful for law enforcement. So there are lots of policy decisions that can have negative impacts, but we believe that this was the start of reversing it and starting to create some positive impacts where law enforcement could get an upper hand on the drug situation that is happening in Oregon. And some of those photos that you saw aren't nearly as bad as they were. But you know what? If anybody's sleeping on the streets and if anybody is strung out on drugs, it's one person too many because lives are being destroyed. And so we wanted to do everything that we could possibly do to put Oregonians in a safer place, in a drug-free place, get them into treatment, as what they were sold is that their relatives and their friends and their family were going to get treatment. In reality, what we got is just open air drug markets and the unfortunate open air drug use. And you literally would see dozens of people on drugs on your way to work, just kind of out of their minds. And it was not a good situation. So it's improved some, but we have a long way to go. I think it took us years to get in this situation. I think it'll take us years to get out.
Thank you. My other question was, so I'm in Kentucky and we don't have any funding behind DEC efforts here. We're just on, like you all, getting started, but you're way ahead of us with getting money behind that. So it's amazing what you were able to do in that short session. And for your colleagues who weren't necessarily on board with it, what was some of the pushback or the reason? I'm just thinking for future to be on the defense and to make the case. What were some of the things that they were concerned about with supporting this?
Yeah, so because, as Monica said, because of the pilot program that Oregon engaged in, which is about 4 years old, as it relates to child welfare. And the whole idea was to lower the number of kids essentially in foster care. And so there's an element out there that don't want to focus on drug endangered children and households because it kind of shows that there's a problem. And the problem is when you're leaving kids in a drug endangered environment where they're being neglected, sometimes they're being sold, and we know what happens. And then with fentanyl, just the fumes of fentanyl alone, the secondhand smoke, as it were, can actually kill you. And we've seen that kids have eaten the fentanyl and, they don't know any better. And so the pushback really was, do they want to give up on yet another failed policy on the child welfare side? And it's always give us more money and give us more time and the policy will work. Well, unfortunately, we were stacking up, dead bodies and affected kids in the process. And I'm just not willing to do that for, a policy that's not working. And so there was some pushback on that part of it. I think for the most part, the money that went to education and prevention was generally, pretty universally supported, but I know there were a few holdouts. But when you bring in the evidence and the data and honestly the parents of kids who've been lost to these drugs, it changes the equation really quickly.
Thank you so much.
I'm not seeing any other questions come in, but I had one maybe for both of you for kind of a final thought. So 5 years down the road from now, what is your hope and your vision for the impact of this legislation?
Well, Monica, you better tell them.
Well, I think it's probably very clear that I'm very passionate about advocacy and especially standing in the gap for the children and for children to be able to live safe and healthy lives and to be supported and to live in drug-free homes, but also not to be challenged with things like neglect or abuse. But if that were to happen, which it does, and one of the things that I've learned over the years, because I'm all about prevention, but you can't prevent everything, right? And through the landscape that I shared with you with the riots and the fires and the ice storms and COVID, is that we can't stop trauma. We can't stop the abuse as much as we want to, as much as we want to continue to put rules and regulations and assess, arrest the perpetrators. At the end of the day, children and adults are still going to experience trauma. So what we can do then is just create processes and protocols to intersect at that moment of critical incident. And so to make sure that all children have that opportunity to share their story is really what I'm advocating for, and that they can be safe and not be endangered, but if they do, to have somebody there to walk them through that process and have their voice heard.
Yeah, Carrie, I would add to that. Obviously, I agree with Monica. We want to make sure that kids are in a much safer place. But we want our state back. You know, we want our state back from the drug cartels. 5 different drug cartels moved into Oregon in a pretty substantial way. And not only do they do drugs, but they also do human labor trafficking, sex trafficking, and so on. And it's generated just a lot of tragedy and a lot of criminal activity. And in essentially in decriminalizing drugs, that's what had happened, is the cartels gained an upper hand and in some areas just control. And so 5 years from now, we're hoping that we've regained control and law enforcement is keeping us safe and keeping kids safe, and you know, we're able to walk our streets during the day, let alone in the evening, as we try to go about our daily lives. And so it's really about doing good things for the people that we represent. And we're hopeful that 5 years from now, and these bills are just the beginning, that there will be people who will add to the good that's been done with just some of these things that we've started here in Oregon.
Well, I absolutely think that that is a possibility with the two of you in the corner for Oregon. I think you guys are, you got a great foundation placed, and I know that you'll continue to fight for the children and the families throughout your state. And I know that I can say that and echo that for everyone else joining the call today, that you guys are all out there for the children and families in your communities. You are doing whatever you can to help them, and all the little and small ways they're making an impact and they're making a difference. So thank you all for joining us today and being here with us. And again, thank you, Senator Knopp and Monica. We really appreciate you sharing your experience and your expertise on this, and we look forward to working with you guys more.
Thank you.
Thank you, everyone.